as far as we are concerned, there is no such thing as pancreatic cancer. There is a disease called malignancy that is affecting the whole system. And in this particular case of pancreatic cancer, the first cells that are changing character happens to be in the pancreas. We often have to deal with cases where a patient has been diagnosed with pancreatic cancer by virtue of a scan and CA 19.9 readings, has been taken to the operation theatre, surgery was attempted but abandoned. The abdomen was closed and the patient was released, saying that the case is inoperable. The patient's original symptom of acute pain in the abdomen continues, and we take up the case from that stage. So when we take up the case, we again do the treatment from three distinct perspectives. With three distinct objectives, we implement the treatment. First, the system level treatment. We want to fight the disease influence that is affecting the whole system, called malignancy. We want to target and neutralize that disease influence. Second, we want to do targeted treatment, and in this case we already have evidence from the various investigations such as MRI, CT scan, ultrasounds, and of course the tumor marker test of CA 19.9. Third one will be the symptomatic and crisis management. The symptomatic, as in this case pain and lots of other problems. We monitor each of those parameters as part of our treatment, and we implement a comprehensive, closely monitored treatment. That monitoring is based on two kinds of feedback. One is of course the subjective feedback, which is what the patient is saying. Second, we also take the objective feedback. The objective feedback meaning what the machines are saying, what are the blood tests saying, and we implement the treatment. And if pancreatitis related parameters were out of range like amylase and lipase, we would also take those into account and progressively implement the treatment in a manner that these show continuous and sustained improvement. The big difference between conventional homeopathy and our line of homeopathy is that we have specific and targeted medicines for each of these parameters. We are able to address each of these parameters such as SGOT, SGPT, alkaline phosphatase, amylase, lipase, different medicines for each of these parameters, enabling us to actually address them in a very fine manner. That means if only this parameter is out of range, we can select only that particular medicine for that purpose, and when that gets corrected, we can move to other focus areas as and when needed. What is important is not just the targeted treatment. It is equally important to make sure that the disease, which is a systemic disease, does not really migrate to other parts of the body and manifest itself as metastases to other parts of the body. Our team keeps a close eye on any symptoms that may indicate a possible metastasis. Thousands of such patients are seen by our team, and they know how to actually look for symptoms and make sure the appropriate detailed investigations are done to rule out metastasis or any other kinds of involvement which may be attributed to the main disease. And if they are, then appropriate actions are taken in time.